Health Talk Made Simple by Aziz. Section 1. Introduction. Your body's amazing cleaners. Health Talk Made Simple by Aziz. Let's start with a simple question. Do you know where your kidneys are? Imagine two small bean-shaped organs, each about the size of your fist, tucked away in your back, just below your rib cage. They might be small, but their role in your health is enormous. Think of them as your body's highly advanced 24/7 water purification and waste management plant. These aren't just any organs, they are your body's master cleaners. Every single day, they work tirelessly, without you even noticing. In fact, they filter all the blood in your body, about 200 quarts of it, many times over. That's like cleaning a bathtub full of water almost 10 times a day. Their main job is to sift through your blood, removing waste products and extra water. This carefully filtered waste and fluid then leaves your body as urine. This constant cleaning service is absolutely vital to keeping you healthy, balanced, and feeling your best. Without them, harmful toxins would build up, making you feel tired, weak, or even sick. Your body would be completely out of sorts, like a house where the trash is never taken out. But their job description doesn't end there. Your kidneys are also brilliant multitaskers, performing several other critical jobs to keep your entire system running smoothly. For example, they help manage your blood pressure by controlling fluid levels and making a hormone that causes blood vessels to constrict. They also produce another crucial hormone that tells your body to make red blood cells, which carry oxygen everywhere you need it. And that's not all. They activate vitamin D to help your body absorb calcium, which is essential for strong bones. At the same time, they carefully balance the levels of other minerals like phosphorus and potassium, ensuring your muscles, nerves, and heart all function correctly. So, these small organs are true unsung heroes of your health. Kidney disease is often called a silent condition. This is because your kidneys can lose significant function before symptoms appear, as healthy tissue works harder to compensate. Eventually, waste and fluid can build up in your body. So what are the signs? You might feel deep, persistent fatigue, often from anemia. Another common sign is swelling, called edema, from retained sodium and water. This can appear in your ankles, feet, and legs. You might also notice it in your hands or as puffiness around the eyes. Changes in urination are also a major red flag. You may need to urinate more often, especially at night. Or your urine might be foamy, darker, or even pink from blood. These are direct messages from your body. Get checked. To check your kidney health, your doctor will likely start with a simple blood test. This routine procedure provides a wealth of information about how well your kidneys are filtering. A small blood sample is drawn from a vein, a process that takes just a few minutes. The vial is sent to a lab where technicians analyze it for two important markers, creatinine and the estimated glomerular filtration rate, or eGFR. These results show how well your kidneys clear waste from your bloodstream. You usually don't need special prep, and results arrive in a day or two. A single test is one piece of the puzzle, so your doctor may repeat it to look for a pattern. A slightly high number may not mean trouble, but it deserves a sensible follow-up. The first key number is creatinine, a normal waste product from muscle wear and tear. Healthy kidneys filter it out of your blood. If they struggle, creatinine builds up. Think of a clogged sink. Rising creatinine is like rising water. The filter is clogged. The second number is eGFR, which uses your creatinine, age, and sex to estimate kidney filtration. Higher eGFR is better. Lower suggests reduced function. A result below 60 for 3 months can indicate chronic kidney disease. Doctors track eGFR over time to decide on treatment. Together, they give a clear picture of your kidney health. After looking at your blood, the next logical step for your doctor is to look at your urine. A urinalysis gives an equally important view, what the kidneys are letting slip through. Analyzing urine is like reading a direct report from the source. You'll provide a clean catch midstream sample, clean the area, start to urinate, then collect mid-flow. In office, a dipstick checks for protein, blood, sugar, and infection signals. In the lab, a microscope can find red and white cells, crystals, and other elements. Sometimes, a 24-hour urine collection measures exactly how much a substance, like protein, is lost in a day. It offers a fuller picture than a single spot sample. Urine testing can reveal trouble long before symptoms appear. It's simple, painless, and non-invasive. A powerful window into kidney health. When your doctor checks your urine, one of the most important things they look for is protein. Specifically, a type of protein called albumin. Normally, your blood is full of albumin, which is essential for many body functions, but it's supposed to stay in your bloodstream. Think of your kidneys filters, the glomeruli, as a very fine kitchen sieve. When you pour something through, the sieve lets water and tiny waste particles pass into the urine, but it holds back larger, useful things like protein molecules. Healthy kidney filters are excellent at this job, keeping valuable protein in your blood where it belongs. When these filters become damaged, they get leaky. Finding more than a tiny trace amount of protein in the urine is a sign of this leakage. This condition is called proteinuria, or albuminuria if it's mainly albumin that's escaping. Even a very small leak, called microalbuminuria, is a key early warning sign. It tells doctors that the kidneys are under stress, often long before you would feel any symptoms. This is especially important for people with conditions like diabetes or high blood pressure, which can strain the kidneys over time. The good news is that catching it early allows for action. With medications to protect the kidneys and lifestyle changes like diet and exercise, the damage can often be slowed, stopped, or in some cases, even reversed. Another important finding is blood in the urine, a condition called hematuria. Sometimes it's visible, turning the urine pink, red, or the color of cola. Other times, the amount is so small it can only be seen with a microscope. Blood can appear for temporary reasons, like a urinary tract infection, a kidney stone, or even very strenuous exercise. However, when doctors see both blood and protein together, it points more strongly toward a problem with the kidney filters themselves, a condition known as glomerulonephritis. A single abnormal test isn't always a cause for alarm. Your doctor will likely repeat the tests to see if the finding is persistent. By combining your urine and blood test results with your medical history, they can pinpoint the cause and create a plan to protect your kidney health for the long term. After blood and urine tests, if your doctor needs more information, they'll often order imaging. The most common, safest test is an ultrasound. It uses harmless sound waves to create live pictures. No radiation. Blood and urine tell function. Ultrasound shows form, size, shape, cysts, tumors, abscesses, and stones. It also checks for blockages and hydronephrosis from stones, enlarged prostate, or other issues. You lie on a table, warm gel on your side. The technician moves a small probe. You feel gentle pressure. It takes 15 to 30 minutes. It's quick, easy, and extremely safe. A powerful visual checkup of your kidneys. Sometimes blood, urine, and ultrasound show a serious problem but not the exact cause. A kidney biopsy removes a tiny tissue sample to examine under a powerful microscope for a precise diagnosis. Recommended for sudden kidney disease, lots of protein loss, unclear causes, or checking a transplant for rejection. Results show the type of disease, inflammation, scarring, and outlook, guiding treatment. A nephrologist or radiologist uses ultrasound or CT to guide a thin needle into the kidney after numbing the skin. It takes about 30 to 60 minutes. Then you rest flat for several hours while your team monitors for bleeding. Most people go home the same day or next morning. Soreness is common. Serious issues are rare. Your doctor weighs small risks against the big benefit of a precise diagnosis. Health Talk, made simple by Aziz. After all the tests, your doctor combines everything to get a complete picture of your kidney health. Think of it like a detective gathering clues. Each test result is a piece of the puzzle. By putting them all together, your doctor can see the full story, understand the root cause of any issues, and determine the best path forward for you. Your blood tests, like creatinine and eGFR, directly measure how well your kidneys are filtering waste. Urine tests are just as important, checking for tiny leaks of protein or blood that signal kidney stress. An ultrasound gives a visual inspection, showing the size and shape of your kidneys and looking for any physical blockages. And if a closer look is required, a biopsy can provide microscopic details for a definitive diagnosis. If caught early, managing kidney disease often starts with simple but powerful steps. This can include medications to lower your blood pressure and reduce protein in your urine, which helps protect your kidneys from further strain. Your doctor will also guide you on lifestyle changes. This includes staying well hydrated, limiting your salt intake to manage blood pressure, and sticking to your follow-up appointments. Adopting a kidney-friendly diet, which is often lower in salt and protein, and carefully managing your blood sugar if you have diabetes, are crucial steps to protect your kidneys for the long term. It's important to know when to seek help. See a doctor if you notice persistent swelling in your legs or ankles, feel unusually tired all the time, or see significant changes in how often you urinate or what it looks like, such as its color, or if it appears foamy. Don't wait for symptoms to appear. Regular checkups are vital, especially if you have risk factors like diabetes, high blood pressure, or a family history of kidney disease. Early detection is your best defense. One-line summary. Simple tests help doctors find and treat serious kidney problems early. Health Talk, made simple by Aziz.